Well, I've been in the field since 2011. I've worked at multiple vet clinics from just private practice to ER, and then I finally settled on working at the shelter, an animal shelter, which has been great, but that has been just the most stressful area for me. Just the amount of animals that are coming in. Our facility is at 150% capacity on dogs. We're euthanizing today, so we're getting the brunt of that, which is very heartbreaking, especially when you've got puppies with parvo and we don't have the place to treat them, or those kittens with pan loops. Just kind of learned, kind of take everything as I can. One, to not overload myself, because I am definitely one of those people that I don't want to euthanize babies, so I would be bringing home multiple little litters of bottle babies, and I've got like 6 different litters of 4 or 5 bottle babies, and I'm staying up all night trying to keep them alive.
Yeah.
And then going to work the next day exhausted, and then trying to keep all those animals alive. So I definitely have learned to not overburden myself with all that, and to learn that it's okay we need to take care of ourselves first. If we're not taking care of ourselves, we can't take care of those animals either. My daughter is 8, so she doesn't fully understand, but I've been able to talk to her a lot. So she actually, now knowing a lot more about what I do, she steps in and helps out a lot more with the animals. She'll feed the animals. I got the dogs, or I've got the cats, or whatever. She'll step in and just take care of the other animals. We definitely have gotten a much better relationship now that I actually have talked to her and kind of explained it a little bit more to her. Honestly, I think I would probably be out in the field. When I moved over to the shelter, I had quit emergency med, and I was in their managed intake program. So I was the one making the appointments for owner surrenders of dogs. And at that point, I was like, I'm not going into vet med. I'm done. I don't want to do it anymore. I'm done. I can't deal with it anymore. And I ended up going into the vet field there at the shelter just because it was a full-time job. So it had benefits and it had more pay. And then after being there for a year, which is about the time I started the program, I was on the verge of looking for a new job. I remember talking to one of my friends. I was like, I don't know what else to do with my life. I've been doing this for 10 years. Like, I don't even know where to begin to look for something else. This is all I know. And then I went to the program, and it really kind of, I don't know, reburned that Kindle in me to keep doing what I'm doing and to keep going. And, I want to help other people who are also feeling that burnout. We have a lot of turnover. So, trying to get through that and not have the burnout of seeing all the problems that we have working with the public. We have to take everything in, seeing those hit by cars. I think it was a great program. I think more of our staff should do it. I think it would definitely help with retention rate. And these people, they want to help animals, and I know they do. They definitely have that care in them.
Mm-hmm.
I just think that they need a better support system.
Yeah.
I do. I've talked to some of them when they were having like their really, really down days. And I've kind of been able to bring them up a little bit.
Mm-hmm.
Maybe not, fully all the way back up, but back from that brink. I would tell them it's definitely worth it. I went through all the program. I even went to one of your lectures at the Fetch in Kansas. I went to some of those up there because I was up there. Because a lot of the times what I did is I listened to it while I was doing other things.
Mm-hmm.
And even if you can't, sit there and watch the videos, just listening to the videos or listening to the books, and just there'll be one quote that just, for some reason, it just sticks in your head, and you'll think you're too busy, just like you guys said, the stacking, which is what I did a lot. I did a lot of that.
Yeah.
I did a lot of stack, and I did that anyways. I didn't realize that's what I was doing, but I did a lot of that. That's how I get a lot of my continuing education for my youth certification done. But just giving them ways to realize that you do have time to help your mental health, and you definitely need to take the time to help your mental health, because if you don't, you're not going to be able to continue doing what you really want to do and what you're passionate about.
Do you have any ideas for people like who want to do it as a group?
I would love that to be done. Even if you already have something implemented, I think the program would help out a lot, especially if you have people going through it at the same time, because then they can talk about it, they can compare notes, compare ideas, just having someone else. Yeah. And I've used multiple things. Like I used my employee assistance program this year. I've used your guys' program this year. I've seen a therapist this year.
Yeah.
I mean, I've done multiple things this year because I've had different things that I've needed to use different things for. You know, your guys' program helped me just want to stay in the field and not actually leave the field, which I don't want to do. You know, this has been my passion. I've loved animals since I was little, and I don't want to leave the field, but I also need to take care of myself. You know, I really did like the meditation and mindfulness course, because I've always wanted to do meditation and stuff like that. I just wasn't quite sure how to get started, so like that really helped. So I really did like that course.
Do you have like a small practice that you're starting to do daily?
I do. I typically do it right before I go to bed, because I have trouble sleeping. So it's helping me sleep.